Let's talk about Africa's new public health order. What is the new public health order that you've been working on at the Africa CDC? Why is it important? And what does it mean to us as ordinary Africans?
The new public health order is a vision for Africa to be able to handle its health security agenda locally, where we set our priorities, we set the direction, and we guide the pace at which we deliver for health security on the continent. We want to be in charge of our destiny, and we want to be in charge of prioritization of our activities. This is the essence of the new public health order.
Thank you for joining us on the HSS podcast with me, Lenias Hwenda, where we talk to leaders and change makers who are transforming healthcare in Africa. This is the Titans of Industry podcast series in which we are talking to the movers and shakers who are shaping the development of an African pharmaceutical and vaccine manufacturing industry. They talk to us about their work, the opportunities and the challenges of making medicines, vaccines, and other medical products on the African continent. A viable and sustainable vaccine manufacturing sector requires that policymakers create the right policy environment that is conducive for manufacturing businesses to succeed. The Africa CDC plays a pivotal role in coordinating the creation of the appropriate policy environment, including by setting the agenda on Africa's public health priorities. Today, I am in conversation with Dr. Ahmed Ogwell Ouma, the Deputy Director of the Africa Center for Disease Control, who is here to talk to us about Africa's new public health order, his vision for the Africa CDC, and where the Africa CDC is headed after a very successful response to the COVID-19 pandemic. Ahmed, welcome to the HSS podcast. It's my great pleasure to have you on. So let's talk about health in Africa.
Thank you for having me. It's a pleasure to be here.
Wonderful. So let's start by talking about what the Africa CDC is. The Africa CDC is one of Africa's most important public health institutions, working on the front lines of securing the health of Africans and the economies of African countries. Can you just explain to us in your own words, what is the Africa CDC? What is its purpose? In other words, why was it created and when was it created?
No, thank you. The Africa CDC is a special purpose vehicle born out of a crisis and established to manage health crisis. It is a vision of our heads of states, the Assembly of the Africa Union of Heads of States and Government, and which came about as a result of the Ebola crisis in West Africa 2014-2016. During that time, it was very clear that the Africa Union could not be able to rally the whole continent to be able to respond effectively. And in fact, I dare say that during that time, multilateral organizations, whether non-state or state-driven organizations, did not do a very good job of bringing the Ebola crisis to quick control. And our heads of state saw that, and they decided at that time that the Africa Union needed its own public health agency. So that's where the journey picked up momentum. It began before the crisis, but it picked up momentum at that time. Throughout the process of establishing the Africa CDC, there was a lot of negotiations amongst the member states so that they can be able to get the organization that they wanted. So the Africa CDC was established as a specialized technical institution of the Africa Union. And it is designed to support all public health initiatives on the continent, to support public health initiatives of the member states, and really to strengthen the capacity of public health institutions, whether they are continental or whether they are national. It is to strengthen the capacity of these public health institutions so that we can be able to detect, prevent, control, and respond quickly and effectively to any disease threats on the continent. At the time of establishment, the vision was very clear. The vision of Africa CDC is a safer, more integrated and prosperous Africa in which our member states can be able to efficiently prevent disease transmission and, of course, implement all the surveillance and detection initiatives that are required to be able to do this. So officially, the Africa CDC was launched on 31st of January 2017. And so we are just over 4 years old, and we are looking forward to the 5th anniversary in 2022, 31st of January. And as you know, many children don't make it to their 5th birthday on the continent, but this child, Africa CDC, we are looking forward to it crossing the 5th anniversary during January 31st of next year. So this is how the Africa CDC came about, and its mandate is really health security on the continent, supporting all our institutions at the continental and the national level.
We are very much looking forward to seeing this child reach her 5th birthday, and hopefully that will lead to millions of children in Africa being able to survive beyond that birthday, because we birthed this particular child who is, you know, protecting the health of those children across the continent. And so the Africa CDC was born out of a crisis with the Ebola outbreak. And of course, it proved very timely because it allowed us to be ready for a much bigger challenge, the COVID-19 pandemic. But in terms of the mandate for which the Africa CDC was created, has that evolved, you know, to where it is right now? It's only been 4 years, but do you see that evolving and changing in terms of expanding that scope in terms of what it's supposed to be dealing with?
The mandate has not changed. The mandate remains the same, but implementation of the mandate has been evolving. At the beginning, Africa CDC was a relatively small organization, very few staff, with a very modest access to resources, and also relatively few partnerships. With the time, what has evolved is the efficiency of implementing that mandate. While in the beginning, it was largely preparing for any possible health threats, it evolved into actual response to the Ebola, the 10th, 11th, and 12th Ebola outbreaks in the DRC, where we had boots on the ground, and we tested the capacity of Africa CDC very successfully, I may add. And from there, it has been tackling different health emergencies on the continent, whether it was Lassa fever, monkeypox, cholera, vaccine-derived polio, repeated outbreaks of Ebola, Rift Valley fever. We have tackled many different outbreaks on the continent. And then, of course, came the COVID pandemic, and we have been responding to that as well. So the mandate has not changed, but the pace, the efficiency, the breadth of response on the continent has expanded. Second is expectations have expanded. Expectations from our member states, expectations from our partners, expectation from the public health community has expanded. And we have responded to this increased expectation by delivering. And we've been doing our very best to deliver quickly and to deliver efficiently. So this is the way in which things have evolved within the Africa CDC. And as these expectations, as the breadth of response has expanded. We have also expanded in terms of expertise. We have way more staff. In the beginning, we had just about 10 when Africa CDC was being established. Today, we are over 300, running very quickly towards 500, in fact. So we are expanding in our capacity internally. We are expanding in the types of experts that we have within Africa CDC. And so this expansion results in a lot more work for Africa CDC, and our member states are quite satisfied with the way that we have handled the different types of emergencies that have come, and we have responded to their needs and to their expectations over the last 4.5 years. This is what has changed, and we have been responding appropriately depending on the evolving nature of public health emergencies in Africa.
Those kinds of issues. But you mentioned that when you started, the funding, you were very limited in terms, the funding was very modest. And as you have grown with time, the expectations of member states have risen. And with that, your responsibilities and the capabilities that you have to build internally. The challenge, of course, with institutions, public health institutions in particular, is always the mismatch between the expectations of what you're expected to deliver and the amount of funding that is often available to actually deliver on that mandate. We see this again and again in the WHO. So talk to us about how the Africa CDC is funded, and whether that funding has also increased accordingly, to meet those expectations, to actually allow you to be able to deliver on those expectations.
Yeah, so Lenias, let me step back and talk about how Africa CDC is resourced, because the availability of resources goes beyond funding. And this is very important for us at Africa CDC. But basic funding is our member states. The Africa Union member states are the ones who provide the two blocks of funding, which is operational and program. This is where we get our basic funding from. The level of funding has not changed in a very big way because of, in the beginning, the range of activities that Africa CDC was involved in was relatively small. And with the time, as that range has expanded, COVID came, and therefore austerity budgets had to be instituted because countries are not performing as well as they were before. So the level of funding by our member states has not changed. That is the program and the operational budget. But the overall resources available to Africa CDC have multiplied significantly, and in the following ways. One is our member states, the Africa Union member states, apart from maintaining the funding envelope for Africa CDC, while they were reducing others, the one for Africa CDC was not reduced. So this is a good thing. It is not where we would like it to be, but it has not been reduced. Second is that the same Africa Union member states, some of them have actually provided extra budgetary funding, that apart from what we have already identified as the basic needs of Africa CDC in terms of operations and programs, they have put extra money into particularly our response to COVID and also to Ebola. So our Africa Union member states have actually done this, and we are very grateful to them. The other way that our resources have expanded is in partnerships. We have gone into many partnerships where we have access to technical resources from a vast array of partners: government, intergovernmental organizations, non-state actors, private sector. We have actually cut across. Even members of the public have been chipping in. So we have access to technical capacity from a very wide array of partners. At the same time, Partners have also made available actual funding to be able to tackle the different types of mandates that we are involved in. And not only for COVID. COVID has come with its own special attention, but we have funding across many areas of our work, including non-communicable diseases and mental health. So actual funding has also increased because non-state actors, state actors, intergovernmental organizations have provided Africa CDC with extra resources. So if we compare, for example, 2017-2018 era and 2019-2020 to present, the resources available to Africa CDC have increased tremendously. But I must underline that despite that increase, we are still operating at about 10-15% of our actual needs. And the needs not of Africa CDC, but the needs of the continent. So when we look at the requests that are coming in from our member states for support, and we look at the pot that we have of resources, then we are still quite far, and we need to build that resource envelope, and not just money, but also the technical capacity and equipment and other possible resources that we need when we are preparing and responding to health emergencies on the continent. So this is the journey that we've been making, and we continue to open up different areas of partnerships so that we can be able to meet the need and the expectation of our member states on the continent.
That's indeed a positive development, that your funding has increased and that you've been able to leverage partnerships in order to expand your capabilities in terms of trying to meet the needs that exist on the continent. But obviously, clearly, those needs are much too great, and you still need a lot more funding to expand enough to be able to meet the needs that exist. And the Africa CDC, the African continent, is often dealing with multiple disease outbreaks. And you're currently dealing with the Ebola virus disease outbreak situation in Beni Health Zone in Northern Kivu in the Democratic Republic of Congo. So how many fires are you currently fighting at the moment? And how concerned are you about this latest outbreak of the Ebola virus disease?
Let me start with Ebola, and then I will go to the broader areas where we are currently involved in preparedness and response. For Ebola, we are concerned. And we are concerned because the current outbreak in the DRC is linked to another part of the DRC, which had the immediately past outbreak. So it means that Ebola as a virus is traveling within the Congo, at least within the DRC. So we are concerned about this, and we have a team on the ground that is supporting the government of DRC in ensuring that the area where this particular outbreak has been identified to have come from is restricted, and we don't get any spillages into other parts of the DRC. So we are very concerned because of that linkage. Right now, we are using a lot of genetic sequencing. Pathogen genomics has become a tool that Africa CDC uses for all outbreaks, not just for COVID, where we hear about different variants all the time, but also for Ebola this time, and for all others that I'm going to mention shortly. By doing pathogen genomics, we can trace where a pathogen has come from, if it is linked with previous outbreaks or not. And the fact that this particular outbreak is linked to previous outbreaks within DRC is a concern, because it means the virus is moving from one part of the country to another. Now, when we look broadly at the interventions that we are involved in now on the continent, there are 5 significant ones. One is measles, and it's across several countries. Second is vaccine-derived polio that we are seeing popping up in a few countries as well. Third is Lassa fever, again, largely in Nigeria, but also its neighboring countries are getting affected. Fourth is Rift Valley fever, which is affecting particularly the Sahel countries and the Horn of Africa. And finally is cholera, which keeps on popping in different places on the continent, depending on the sanitation situation, as well as the rain as it comes and goes. So these are 5 big ones that we are working on the continent, but others, monkeypox, keeps on appearing and disappearing, and we keep on supporting our member states on the continent. The message here is that although we sort of get a lot of media attention for COVID, we get a lot of media attention for Ebola, there are other situations of the continent that demand our attention. Things like malaria are still there, HIV, TB, these are still here with us. And we need to step back and ensuring that we are tackling them with the same urgency that we are tackling the other more media, which have more media presence, like COVID and Ebola. We need to tackle all those because they are still within our mandate as Africa CDC, and we give them the attention that they deserve within the resources that we have. So we are kept quite busy, even as we tackle the COVID pandemic.
Absolutely. It sounds actually very challenging that as you deal with emerging challenges, you have some challenges where we've had successes. For example, the eradication of polio. Now you're dealing with the vaccine-derived polio. We have fallen behind, presumably, as in childhood vaccination as a result of the service disruption that is coming out of the shutdowns to control COVID, and that's creating problems of its own with measles outbreaks in children. Now that is quite a plethora, a range of things, balls that you have to have in the air, and this is coming in a context where a significant proportion of our health problems affecting large fractions of the population have been neglected over many, many decades. I'm thinking here, non-infectious disease problems, cancer, non-communicable diseases, and so forth. And it seems that the burden of disease is growing, and we are not yet able to meet the current needs, and we have new challenges coming up. Out of all of this, how does the Africa CDC choose where to focus? And do you need to be more focused in some areas than others, or is there a risk of spreading yourself too thinly? How do you balance that so that everything is attended to as it should?
Balancing is always a challenge when resources are limited, and we have very limited resources. And as I was saying at the beginning, just about 15 or so % of what we need is what we have. And that means that there's a very large gap to be able to reach where we think we'll be functioning optimally. So we are guided by the nature of the emergency and the possibilities of arresting it quickly. So if an outbreak appears, for example, now we have Ebola in one part of DRC, and we are only documenting 1 or 2 cases, it means there is possibility of arresting that particular outbreak quickly. And so we go in there, we give it our best shot, and we arrest the process. So this guides us a lot. The new outbreaks, we don't want them to spread, so we handle them fast. Second is the pathogenicity of the outbreak. There are those outbreaks that really going to cause a lot of havoc, causing high morbidity, high mortality. Those ones we run too quickly so that we can be able to save as many lives as possible, and also ease the suffering of anyone who may come across that type of pathogen. 3 is we always support our member state. So where a member state is able to do it internally, then we provide technical support from far. Maybe we send only 1 or 2 experts. But if a member state does not have the capacity, then we go in there in a bigger way. And always we do this in coordination with all other players within this space of health security, whether it is the UN system like WHO, UNICEF, WFP, or it is non-state actors. We always make sure that we are doing our work in synergy. That way, every resource that is coming is providing a relief to that particular outbreak. So these are some of the things that we consider before we go in. We are really conscious of the fact that we are few. We are too few for what we need to do. And we are also conscious of the fact that our member states still have, most of them still have weak institutions that are designed for public health preparedness and response. And so we are very careful to ensure that we don't get stretched too thin. Having said that, I must add that as we speak today, we are truly stretched because of the pandemic. We are truly stretched because of the urgency of need, not just for testing and looking after those who may be unwell, but also for rolling out the vaccination for COVID-19. And so we are constantly seeking more resources, whether they are technical or financial, to be able to expand our presence and to ease the pressure on the staff that we have currently. But these are some of the things that we consider before we go in and tackle any health emergency that may have been identified across the continent.
Yes, certainly. It sounds like your hands are really full and will continue to be full for the quite foreseeable future. But you mentioned the complementarity that you are working alongside the other public health security institutions in the region. The WHO Africa is one of those. So talk to us about the division of labor then, in terms of what the Africa CDC's focus is and what the WHO Africa does. And of course, you have a second urgency, health urgency of the Africa Union that will be coming into effect within weeks, according to the African Union Special Envoy, Michel Sidibe, the African Medicines Agency. How are you looking at this new entrant, and how are you working with the one that already exists in terms of complementing each other so that you can maximize the resources that you have and the ground you're able to cover?
Let me start, Lenias, with what already exists. And let me start from home, then we go to the neighbors. Within the Africa Union family, we currently have 3 active continental organizations that work in the space of health, public health, and that one is Africa CDC. We do this full time. Second is the Africa Union Development Agency, AUDA NEPAD, which has a very important role when it comes to particularly regulation on the continent. And then 3 is the Secretariat of the Africa Continental Free Trade Area, because as you trade, you must put public health upfront in your planning. So they have a very critical role to play so that they can be able to encourage trade that is health conscious. You don't want people moving goods everywhere on the continent, and with the goods, pathogens are also moving. So these 3 are currently in place and working very closely together to ensure that our various mandates contribute to securing Africa's health even better. The Africa Medicines Agency, the treaty is, we are waiting for the treaty to come into force in a little while. As Michel Sidibe has shared, this will be soon because all the deposits have been done that are required for the treaty to come into force. We are already working with the Department of Health, Humanitarian Affairs and Social Development, which has been driving the process of ratification of the Africa Medicines Agency's treaty. When the treaty secretariat is established, we'll work very smoothly together. We already have a very clear division of labor within the Africa Union, these 4 entities that are working within the public health space. Now, when we look at our neighbors, and those are the other agencies, whether it is within the UN or outside of the UN, also our regional economic blocs, the RECs are also having very clear rules when it comes to public health emergencies. We are working very closely together. We engage on a regular basis. We share information and we synergize our work so that we do not allow resources to be wasted with a duplication of effort. And in this way, we are able to tackle different health emergencies from a different perspectives. Remember, public health is the same. When we say public health, it is broad, but it is the same. And all of us are working within the same space. So it's an issue of dividing what strengths each organization have, what unique roles that each organization has been established and given mandate for. And in that whole milieu of public health, we ensure that what we are bringing onto the table is actually helping the African continent. It is complex from outside, but those of us who are inside, we have very clear MOUs with all the relevant stakeholders. We have a very clear way of working, particularly at country level, where the governments will lead and ensure that all partners are contributing to the larger country level plan. And continentally, we are very uniquely placed as Africa CDC and all the AU organs because we touch the highest levels of policy making. Our heads of states, we engage with them on a very regular basis. Our ministers, depending on which sector, we engage with them on a very regular basis. And our technical heads of the different member states agencies, we also engage on a very regular basis and ensure that all the policies and all the actions that we are having on the ground are synergistic. This doesn't come without challenges. There will always be challenges, but we have a mechanism of managing those challenges whenever they come. And as I speak right now, we are having a meeting going on between ourselves as Africa CDC, WHO, UNICEF, Gavi, and the Africa Vaccine Acquisition Task team, so that we can synergize the way in which we are doing vaccine acquisition and vaccination rollout on the continent. So we have a mechanism that addresses challenges whenever they come.
Well, that's great. We can see it's complicated, but as long as the thing works and we are safe, that's all we are concerned about. We don't really want to see how the sausages are made in the sausage factory. So let's talk about Africa's new public health order. What is the new public health order that you've been working on at the Africa CDC? Why is it important? And what does it mean to us as ordinary Africans?
The new public health order is a vision for Africa to be able to handle its health security agenda locally, where we set our priorities, we set the direction, and we guide the pace at which we deliver for health security on the continent. We want to be in charge of our destiny, and we want to be in charge of prioritization of our activities. This is the essence of the new public health order. Now, the new public health order has 4 pillars, which, if implemented effectively, we should never have a repeat of what we saw in West Africa, and we should never have a repeat of what we are seeing now with the COVID-19 pandemic. The 4 pillars are, 1, strengthening of public health institutions on the continent and at the regional and country levels. So any indigenous public health institution that is working on this continent at any of the 3 levels, continental, regional, and national, should be strengthened. That is why we are encouraging our member states to each have a national public health institute, which will be designed to be able to respond to the health security agenda by rapidly detecting and containing any health emergency at national level. That's why we are strengthening the ability of our RECs, the regional economic blocks, to be able to come up with policies that are good for public health emergency preparedness and response, and also to have mechanisms of coordinating at the regional level to ensure that preparedness and response for any health security issue on the continent is prioritized. That is why at the continental level, we are strengthening all the agencies that deal with health security matters, whether it is Africa CDC that is coordinating it, or whether it is the Africa Medicines Agency that is about to be born, whether it is the Africa Continental Free Trade Area Secretariat that is ensuring that trade is done within a public health safe context, or whether it is the Africa Union Development Agency, or the NEPAD, that is guiding the policy, particularly the regulatory area, in a way that is good for public health. So the continental agencies need to be strengthened so that they can be able to deliver on the mandate that all will eventually contribute to securing Africa's health. So this is the first pillar, strengthening public health institutions of the continent, continental, regional, and national. The second pillar is strengthening our workforce for public health emergencies. We need all the cadres that are required for preparedness and response to be in place at the national, regional, and continental level. And this means that we must define which cadres we want, and then ensure we have enough of them, and where there are gaps, we train more. And because of the natural cycle of life, some leaving for whichever reason, death, resignation, transfers, we must ensure that at all times we have the right numbers of the right cadres at all the three levels. We must strengthen our workforce. And not just to have numbers, it is also to have appropriate motivation for them to continue to working here on the continent. We don't want to train people and then we hear they're leading organizations elsewhere in the world. We want them to be here on the continent. So we must motivate them appropriately by a good path, professional development, by giving them appropriate remuneration, and also providing a work environment that is professional and very objective and task success oriented. That way someone feels good when they stay. The third pillar is local manufacturing. If there is one lesson that we have learned that is painful, it is that when you're not in charge of your supply chain, you cannot be able to plan. You will recall in the beginning of this pandemic when we couldn't even be able to get decent masks, just masks. Decent masks for our healthcare workers was a problem. So the third pillar is to ensure that we have adequate manufacturing capacity on the continent for all health products, whether they are basic like masks, or whether they are complex like vaccines and everything in between. For diagnostics, you know, today, for HIV, for example, we don't have a stable manufacturer of HIV rapid diagnostic tests on the continent. And we are the region, the continent with the biggest burden. This is unacceptable. Malaria, rapid test, only few places are doing this. It is unacceptable. So we must get our diagnostics industry right. We must get our therapeutics industry right. We must get our vaccines industry right. And then we need to graduate into ensuring that we are manufacturing the equipment as well, whether it is simple like microscopes or whether it is complicated PCR testing units. We must get the manufacturing happening on the continent. So the next time there is an outbreak, we are not scrambling elsewhere to get these products. We are doing it ourselves here on the continent. The fourth is we appreciate that we cannot be able to do this on our own. There are people who have done this before, continue to do it, and we need to learn from others. There are those who are our friends and would like to help us and support our plans. We need to bring together partnerships. So the fourth pillar is action-oriented and respectful partnerships. And I underline respectful because it needs to be based on the priority of Africa. And this pillar is extremely crucial in delivering the first three pillars because it will bring together different stakeholders. All of them must align to the vision of Africa where health security is concerned. All of them must align to the priorities of the continent where health security is concerned. And all of them must come and agree to work in synergy with us as the Africa Union, depending on which area and which agency on the continent is coordinating that work, where us as Africa Union are coordinating that work. So the new public health order is designed to ensure that we are in charge of our preparedness and response to any future health outbreaks and any future pandemics, if at all they may come, and we want to be ready for that as soon as is possible. That is the new public health order.
Very clear and really very important, I think, a vision for Africa. And the one in particular that really resonates, that will resonate with a lot of Africans is the autonomy in setting priorities and making decisions of what are the most important things for Africans or the most important health concerns of Africans, and being able to take the health agenda forward in a way that reflects the challenges that African people are dealing with on the ground. I think that is very, very important. So the new public health order, strengthening institutions, strengthening the workforce, establishing a viable manufacturing sector and respectful, smart partnerships that allows you to deliver on that agenda. I think that's really very, very inspiring and gives us hope that we are moving in the right direction to have our health secured by our institutions as Africans. Now, in the Abuja Declaration, African countries made a commitment to spend at least 15% of their GDP on health, but very few countries have been able to meet that objective for various reasons. Does our new public health order include a strategy amongst African countries to increase those budgetary allocations towards healthcare, from the perspective that we hope that now it is well understood that health is not just an expense, but also an investment for our national economic development and economic success? Will that be a part of the new public health order?
It is. In fact, sustainable, predictable financing is one of the enablers of the new public health order. Remember, I talked about the 4 pillars, but at the base of it, there are enablers, and one of those is sustainable, predictable financing. In fact, the Africa Union has made domestic financing of healthcare as a priority. We even have a champion in the person of His Excellency President Paul Kagame of Rwanda. So domestic financing of what the pillars are tackling is an enabler for the new public health order to be able to be delivered. In fact, if there is no domestic, sustainable and predictable financing, we cannot be able to achieve the 4 pillars. So it is not a pillar on its own, but it is going to be an enabler across all the 4 pillars. And we are working with a champion for domestic health financing to ensure that countries on the continent are meeting the pledge of the Abuja Declaration, and they're increasing and even surpassing those levels. This is our message to our finance ministers, that we not only need to meet the Abuja Declaration pledge, but also we need to surpass it, particularly when it comes to local manufacturing. Because that is an investment in healthcare, but it immediately also opens up the economy, because there's huge economic benefits when you're manufacturing a lot of these health products on your own. You open up markets and you can be able to earn from them. So we are encouraging our member states to not only meet the Abuja Declaration targets, but also to pass them, especially when it comes to setting up local manufacturing capacity on the continent.
Yes, indeed. I think when it comes to, I guess, financing the real hardcore public health sort of responses of institutions in the public sector, governments will obviously be needing to step forward, with your appeal to the ministers of finance. But when it comes to developing the infrastructure that you need to make the third pillar of manufacturing, of vaccines, of pharmaceuticals, of medical products on the continent, obviously the governments will not be able to meet those on their own, or at least part of that responsibility would have to fall onto the private sector, investors, and our local finance institutions. In your view, from what you have seen, are our regional finance development banks, for instance, stepping up and making resources available for the private sector to have affordable finance to develop that infrastructure that they are going to need, alongside whatever else investors are going to need to develop a thriving manufacturing sector?
The quick answer is yes. Our regional mechanisms have gone flat out. In fact, they have been so active during this pandemic, you would think they were set up for public health. They have been very, very active. And allow me to mention three of them. First is Afrexim Bank. Afrexim Bank has been at the core of Africa CDC's push to get vaccines onto the continent by providing a financial facility of up to $2 billion that has enabled us to be able to secure the 400 million vaccines. That facility has been made available to our member states. And they have gone one step further during the launch of the Partnership for African Vaccine Manufacturing by signing an MOU to make even more resources available for those countries that want to set up or expand their vaccine manufacturing capacity. So they have been at the forefront. And I must really applaud Professor Benedict Orama, the president of Afrexim Bank, for his dedication to this cause of getting local manufacturing for health products. Very supportive. Second is the African Development Bank. It was one of the first regional mechanisms to step up and support Africa CDC when it came to this pandemic. And during this weekend, when our heads of states were meeting, the president of the bank, Adesina, also confirmed that they are ready, willing to provide support to countries who want to do local manufacturing. And they are organizing a facility that is going to be made available for our member states to expand that space. A third is the Economic Commission for Africa. And Vera Songwe, the executive secretary, has been writing it with us from day one, providing avenues for member states to be able to get funds, whether it is from IMF or from the World Bank or others. They have been extremely, extremely engaged with us in providing those financial facilities. And right now, as we plan for local manufacturing, they are on the table with us, providing all the analytical skills and as far as the economics is concerned, and making life much, much easier for us as Africa CDC to be able to focus on the technical side. So they have been, these three regional mechanisms have been very, very instrumental in making sure that the economic part is covered, the financial part is covered when it comes to planning for local manufacturing. Fourth, in general, is the private sector. And the private sector, from very many angles, have been stepping up. There are those who are already manufacturing on the continent now. There are those who are willing to expand their manufacturing facilities to include vaccines if we so desire. And those private sectors that have come forward, we are making them talk to their governments or the governments that are hosting them, so that we can have this as a PPP. Otherwise, making it only private sector will not work very well, or making it only public will not work very well. We are bringing them together to be able to make this work. So the private sector is key to the implementation of the third pillar of the new public health order for local manufacturing of health products. We need them to get into that space because we are already securing that market through the Africa Continental Free Trade Area. And we are encouraging that expansion because a market of 1.3 billion people is here, and we are going to be very jealous with this market so that only those who are manufacturing on the continent get the first contracts. If you want to manufacture elsewhere, then just bring it here. We'll consider you second, maybe third. But those who are manufacturing here are the ones that we really want to ensure that we are giving the business so that we can be able to expand and strengthen that facility. But these regional mechanisms and the private sector have been very much on board, and we are looking forward to walking that journey with them until we get to our goal of manufacturing substantially on the continent.
That's really wonderful news to hear all of these positive developments in terms of making the funding available to make the new public health order really come to life. Now, when it comes to manufacturing, we've been talking to manufacturers across the continent who are involved in developing production of vaccines. The one thing that every one of them consistently is asking for is that we must have a market. We must have African governments committing to buying local, to buying African. Are you working on a mechanism to enable that commitment so that when these operations come to maturity, there is a ready market to which these manufacturers are able to move their products and be able to sustain their businesses?
The simple answer is yes. In fact, without that, our pillar 3 for local manufacturing will not succeed. And we have identified the existing paths into the African market. One example that I want to give you is vaccines. Vaccines are largely bought by Gavi, the routine immunization vaccines, and then distributed by UNICEF. So if you don't have that path locked in, then a local manufacturer on the continent may not be able to go through that path. We are linking that with the Africa Continental Free Trade Area Treaty because it is prioritizing African manufactured products first. And we want to, we are continuing to engage. And what we want to see is that the first test for the African Continental Free Trade Area Agreement platform of trade, the first test should be health products so that we ensure that we secure our market. The second thing that we're doing is we're engaging with all the players in this space, Gavi, UNICEF, to ensure that they appreciate the need for supporting local manufacturers. Because if we don't have a market, then you cannot be able to expand local manufacturing capacity. So we are working on that. It is a priority of ours, and we are utilizing the full strength of the Africa Union to bring this market to the manufacturer who is on the continent. Saying it is easy. Doing it is a lot more difficult. And I tell you, all the successes that we have shared on this conversation today takes a lot of hours of negotiations and convincing and everything legal possible to be able to bring it to where it is today. But in as far as the African market is concerned, it is the instruction from our heads of state through the treaty for the Continental Free Trade Area, as well as the decisions that have been made during this pandemic for local manufacturing, that the African market should first consider the African manufacturer, the local manufacturer, before we do it elsewhere. And we are working on a mechanism that is going to tie this to our market. And within the next, hopefully 18 months or so, this should be locked in, and we get our market to be ours first, and anybody else will come as second if they're not manufacturing on the continent. It's not easy, but we are doing it because they are very well established networks and interests that we have to gently but firmly readjust so that they manufacture here on the continent first before we can be able to bring in anything from outside of the continent.
Indeed. And you know, it's great that you are basically trying to make Gavi commit to also procuring to prioritize local manufacturing, local manufacturers. But as Africans, we have learned to be skeptical because we hear so many things that are promised which does not happen. For many years now, we've heard UNICEF and Gavi say that they procure in a way that spreads risk. Come COVID, we have found ourselves exposed because it turns out the procurement processes of global mechanisms have not been spreading that risk. We have pretty much most of the vaccines coming from a single manufacturer and a single country, even though we were told something else. So is there accountability to make sure that this time, when people say they will commit to purchasing and providing business opportunities for local businesses on the African continent, that will actually happen?
Commitments are right now at two levels, and very important levels. One is our heads of states have pronounced themselves not once, not twice, but many times during this pandemic that we must manufacture locally. And in fact, what we've been asked to do is to come up with a strategy of securing the African market. And that is being worked on. And I am absolutely confident that when our heads of state will receive that report, they are going to put mechanisms in place and commit their countries. Because if a country commits, today, African countries are buying their own vaccines, something that has not happened in a very long time. And if our governments commit to buy our own health products from here locally, and anything else coming will be in addition to what we have already bought, then we become the power who decides where the market goes. This is one level, the heads of state's commitment. Second is with the treaty, the African Continental Free Trade Area. The treaty is so clear that priority is to trade within the continent. And it is trading across board for everything. And what we are saying is let's prioritize health products. And we test it. We test the treaty's trading mechanism using health products. So it is not just a commitment, it is the accountability mechanism is already there in the treaty. And so that's why we are encouraging manufacturers on the continent, expand your production. So that as soon as the platform for trading opens up in the FCFTA, we start with the health products because we need them now. And we are doing that in a limited way using the Africa Medical Supplies platform, where we have a lot of products, but we know which of those products are actually being manufactured on the continent. And we prioritize giving an opportunity to supply to the products that have been manufactured on the continent. It is working. Some people are not happy, but our role is not to make people happy. Our role is to secure this continent, including supply chain, and show that what we produce is of good quality and what we produce has a market on the continent. That way we can be able to polish up our manufacturing capacity and quality and processes. So we are doing that at these two levels, and I am confident that when the Africa Continental Free Trade Area trading platform will be up and running properly, health products will be at the forefront and others will be learning from the health products. As for the instruction that has already been given by the heads of states, it's clear. And there is a report at each and every assembly. How are we doing with COVID? Or what is happening with the manufacturing? How are we ensuring our supply? It's part of the report that we have to give. And anytime that there is any difficulty, we always reach out to the policy organs, and their response has been fantastic. They give us guidance, and then we are able to work on the specifics a lot more easily because we have the confidence our backs have been covered. So the accountability mechanism is good. And this time, Lenias, it is not going to fall through the cracks. We have continental agencies that are in place. We have our heads of state that are very keen to see where we are. And we have technical colleagues who have made very clear decisions that what they are going to use is African produced first and anything else will come second. So I think we're in a good space. What we need to do is ensure that our resources are doing exactly that. And then someone else's resources, when they come, they will follow exactly the same path. We can't do this using resources from outside. We have to do it using our own resources first.
That is very true. It's great that they are using, our heads of states are using the precedents that has been set by the COVID pandemic of having to actually make procurement decisions for themselves and leveraging that to take it forward and having accountability mechanisms that are built in that will ensure that, you know, the words are kept and things happen as we are told that they will. Now, let's finish our conversation by talking about something that has been in the news lately. Now, the Africa CDC is a technical agency of the African Union, but you also have to address the social and political questions that come up that have an effect on public health and our public health responses in Africa. Now, on the 24th of September, the Africa CDC released a statement expressing serious concern about the new rules for visitors entering the United Kingdom. And your statement, the Africa CDC statement, said that the new rules would discriminate between the recipients of COVID-19 vaccines based not on the type of vaccine that they received, but on the region, the place where that vaccination occurred, which means that vaccinated travelers who are coming from Africa, as well as a number of other regions, would not be recognized, even if they received a vaccine that people in the UK and people in Europe have also received. And that has implications, of course, that they will be required to take additional measures like more tests and, you know, at significant cost for those individuals. Now, the Africa CDC didn't have an explanation, a rationale for this particular rule, and you were asking for one. Have you now received an explanation? And is there a scientific and public health rationale that explains the thinking of the government of the UK?
Thanks, Lenias. You know, the thinking of the government of the UK, I do not have access to that, fortunately, and therefore I cannot be able to say why they came up with a suggestion like that. And indeed, any country, and not just the UK, any country that purports to categorize vaccines according to where they have been manufactured or where they have been administered is not following science. There is no science that we know of that would make a vaccine that has been administered in Addis Ababa different from the vaccine that has been administered anywhere else in the industrialized world. That is a decision that needs to be rescinded. We have engaged with all countries that have similar requirements, including the UK, including the EU, including the US, to understand what their actual requirement is. Because sometimes what you pick from the media is not the exact text of what is required. And our engagement with these different authorities of the different jurisdictions have provided clarity, and we are working to ensure that all vaccines administered on this continent and cleared by the competent authorities of the member states on this continent will be reciprocally accepted by the other countries on the other side of the world. We are working on that. Now, two things are very important here. One is that we, as the Africa CDC and the Africa Union, we are very clear that any vaccine that will have achieved WHO's emergency use listing for us is a vaccine that is safe and effective against this pandemic and should be recognized. So irrespective of where it has been manufactured, if it is the same active ingredient and it is being manufactured under license in one factory or the other, and those factories have the requisite regulatory approvals, this should not be a hindrance. And any vaccine like that should be recognized by whichever jurisdiction across the globe. This is one thing that is very important. The second for us is we should not burden the globe, and I'm talking about the whole world. We should not be burdening the world with requirements for vaccination while there are not enough vaccines in the world for everybody. At this stage, what we should be doing is making decisions, making pronouncements that are going to be helpful for vaccination to be accepted, rather than making pronouncements that are going to result in vaccine hesitancy, and which will be very unhelpful to trying to bring the pandemic under control. So at this stage, when we have countries with 1-2% of their populations vaccinated, it is unhelpful to start making a requirement for vaccination. And the science behind vaccination is such that a negative PCR test should be adequate for anybody and everybody who needs to travel from one place to the other. And that is why we put in place our trusted travel portal, where we are actually certifying which laboratories can be able to issue a PCR negative test. That way, that becomes easy to be able to verify anywhere that you go. But to make it a requirement for someone to be vaccinated before they travel is automatically discriminating against the 96% of Africans here on this continent that have not yet been able to be vaccinated, not because they don't want, but because there are no vaccines to be able to vaccinate them with. So it is unfair, it is discriminatory, and it is unhelpful in trying to bring this pandemic under control. We have communicated that to all the relevant jurisdictions across the globe, and we are engaging with them to ensure that we do not end up with a crisis that is avoidable when we put some of these pronouncements and regulations in place. And the progress has been very good. We are very happy with the progress now, and in the near future, we should be able to have a very harmonized way of looking at vaccines, whether they have been administered here in Africa or elsewhere, or whether they're manufactured here in Africa or elsewhere. Indeed, so long as it has WHO emergency use listing, it is our position that such a vaccine should be able to meet certification in any jurisdiction.
That's great to hear, because of course more than half of the vaccines, or at least a large proportion of vaccines that we have received on the African continent have come from COVAX, which were coming, and a large proportion of that were coming from the UK. So as Africans, we just didn't know what to make of the fact that the vaccines that the UK is donating to our countries or providing to the continent through COVAX is exactly the same vaccine they turn around and say it's not recognized for people to enter their country. So it's wonderful to hear that you're discussing this and you're making progress. Now, to conclude, what are some of the biggest challenges that you anticipate that we will be facing, or the Africa CDC will be facing in the new public health order that we have now, which is really quite exciting?
There are many, but let me share three that I think are very significant. The first challenge is that the Africa CDC, the Africa Union, is getting into a space that other organizations had occupied for quite a while. And that by itself will always cause some sort of discomfort. And so the first challenge that I see is ensuring that as we enter into this space and secure the continent's health security agenda, other players appreciate the importance of our heads of state's vision of establishing the Africa CDC. This is not about Africa CDC, it's about the vision of the heads of states of the 55 member states of the African continent. So that is the first challenge that we see, and we are working on that by ensuring that we communicate very openly, regularly with all the stakeholders in this space. The second challenge is one of sustainability. It is very easy to release resources during an emergency, but when the emergency starts to go down, the threat does not go away, because we have so many outbreaks on the continent that can be able to blow up and cut across many countries if we do not contain it quickly. So sustainability, and that means domestic financing to invest in the health security agenda appropriately, and also support from our friends and partners in this space in a sustainable way. Not that when the pandemic is finished, then everyone goes away and you end up with no resources. So sustainable financing is a second challenge that I see. And to address that, we are working on long-term plans and long-term financing, both with our member states as well as our partners. The third challenge I see is one of capacity. That the things that we want to do are going to require expertise beyond what we have currently. And it means that either we procure that expertise quickly within the region, and that will mean resources, or we access it by technological transfer, and that will mean partnership agreements. So the kind of expertise that we need is broadening every day. The numbers are increasing every day, and trying to get that on the continent and secure it so that it can be here on the continent, I see that as a challenge, which we are doing by ensuring that member states are supported to establish their own national public health institutes, in which case they will have expertise at country level, and all we will be doing is polishing up that expertise, knowing that at country level there's already something to start with. We are not starting from zero. And then, of course, continentally strengthening our health institutions as well, so that we are able to produce and provide that kind of expertise that is required. These three I see as the top challenges. There are many more, but those will be able to be easily handled if we can be able to manage these three in a timely manner, so that we deliver on the Africa CDC's new public health order.
Excellent. And one key takeaway, Ahmed, about Africa's new public health order, that if African people are to remember one thing about what Africa's new public health order, it has to be this. What is that?
That we are in charge of our health security. As Africa, we are in charge of our health security. If anyone forgets everything, that's what they need to remember, and invest in being in charge of your own health security here on the continent.
Dr. Ahmed Ogwell Ouma, the Deputy Director of the Africa Center for Disease Control and Prevention. Thank you so much for coming on to the HSS podcast. It's a pleasure to have you on.
It's been my pleasure as well. Happy to be here.
Thank you for joining us. In the first part of our conversation with Dr. Ahmed Ogwell Ouma, the Deputy Director of the Africa Center for Disease Control, on Africa's new public health order and what it means for ordinary Africans. If you support our work and our mission, please do subscribe, like, and share our podcast. We'd also love to hear from you, so do please send us your feedback and your comments. Thank you for watching.